When you're turning in bed, you can divide all products in two groups. One group is all the products that you use by placing them, using them and removing them. The other group of products is products that stays in the bed at all time. When you have a traditional product that you place, use and remove, you need to turn the patient 3 times. Once to place it, a second time when you turn the patient, and a third time when you remove it. When you use a product that stays in the bed at all time, like the WendyLett, you don't need to turn to place it. You don't need to turn to remove it. It means that you're just turning once instead of 3 times. So you reduce the time and the load on the back with 66% like nothing. WendyLett is a product that we use for turning in bed as well as moving higher up in bed. It consists of different parts. It is a base sheet that is covering the mattress. It is sometimes a draw sheet used, a 2-way or a 4-way. And it is also a pillowcase. Now I'll start talking about the base sheet. What we have here is a very slippery material in the center. It is really thin. It's no stitching that could interfere with wounds. You can get this base sheet in 3 sizes. The small one, just covering hips and shoulders. The medium size, covering head, shoulders and hips. And the full length. The full length can be either the same version as we have here that you tuck in, or it could be the one that is like a fitted sheet around the mattress. We also have it for different sizes of beds so that you can get it for the wider beds as well. WendyLett is made so that it's sliding best sideways. And we show that with the stripes. So everybody that sees this product, they understand that it's sliding best sideways. The pillowcase here has the stripes the other way. And it's because the pillow is meant to help you when you're helping a person to slide higher up in bed. The difference in the directions is really big, and we're going to show you that. So look now here. When she's raising the head of the bed, you'll see here that the pillow starts sliding very quickly. And now, next time, if we put the pillow in the other direction and raise the head of the bed, you'll see that it's not sliding. The smallest size of the base sheet of WendyLett will cover shoulders and hips. If you need more, you take the larger size, but this is enough for most people. If you use this on a hospital or nursing home where you have a lot of staff, there is a risk that they place it too high or too low, and then it will not cover hips and shoulders. And if that's a risk, it's better to go for the next size. The medium size of WendyLett will cover head, shoulders and hips. You should place it so that it is all the way up to the head of the bed, then it will automatically cover head, shoulder and hips. This size is best when you have a person that is active. They can bend their legs and use their feet to push, to move higher in bed or turning in bed. If the user is weaker, we choose a WendyLett that will cover the whole bed. Because now it's easier to use it when you're moving the legs. And the full length is in 2 versions. One that you tuck in, and this that is a fitted sheet that goes around the mattress. You can see that if I lift the mattress up, that it's going around the mattress with a string. On this particular one, the sliding surface is going all the way out down by the feet. And it's to help to get legs in and out of the bed. On all sizes, you will see here that where you're sitting, when you sit up on the side of the bed, it's a high friction material so that it's safe. It's only in the center where you have low friction to help you to turn or move higher up in bed. Quite many patients can stay directly on this. If they don't have any clothes on, skin is not sliding good on it, but if they have clothes on, they are sliding really good. And then most of them can be independent, sleeping on this all night. In the WendyLett system, you can also use the draw sheet called WendyLett two-way. It has stripes going sideways, showing you that this draw sheet will only slide sideways. This is a product to use when you have a bed that is flat all the time, and maybe you need it because you're sleeping without clothes, and then, as I said before, skin is not sliding on the WendyLett, but here the draw sheet is sliding. So even if there's bare skin touching, it will slide. It will also reduce the shearing that you will get otherwise. It's another reason for using this one, and it is if you're going to raise the head of the bed and sit in the bed to watch TV or eat in the bed. With this in, you're not increasing the risk of sliding down, but you have possibility of moving sideways. And if you're sitting in a long time, it is really nice if you can adjust your position without sliding down. This is the next draw sheet called WendyLett four-way. As you can see here, the stripes are going both sideways and up and down, and that's what we mean with four ways. It's sliding in four directions. It's also very much more slippery than the WendyLett two-way, because here we have the same slippery material underneath. So now when they meet, it makes it really easy to move a person up or sideways. You can get this draw sheet in different sizes as well. This is the most common size that will cover head, shoulders and hips. You can get it with and without handles. The handles is the new version that I recommend. The handles are at the side. When you're not using them, they will just go in and hide inside so that they don't touch the patient. And you can use them for manual work, but they are more meant to be attached to the lift so that you can use the lift for turning. It's not meant to be used for lifting, but you can use it to attach it here for turning or reducing friction by hip and shoulder when you're moving higher up in bed. If you use a draw sheet, WendyLett two-way or WendyLett four-way, you always have the base sheet underneath. So that's the base for the WendyLett system. You can decide for yourself if you want to be here pushing or if you want to be pulling. If you're two nurses, you can be one on each side, or you can be both on one side. You can use techniques where you just help the person to understand how they should move by guiding them. You could then step up and help them a little bit when the user is doing 80% and you just help them a little bit, up until when you have a totally passive patient that needs a lot of help. Be sure to use the bed's functions when you're using it. Put the bed in the right level and make sure to use the foot end. Move it up when you're moving higher up in bed, and make sure that when you're moving higher up in bed that you do it slowly, because it's going to be so easy that there's a risk that if you use too much force, that you go too high up. So do it slowly and safe. At the side of the WendyLett, I told you that we have high friction material, so that if someone is sliding out here, that they will feel that now it stops, now I'm close to the side, as well as making it safe to sit on the side of a bed. But if you feel that there's at any risk at all, make sure to use some kind of safety so that you put the bed rail up to avoid having someone sliding too far out. This is also really good for a person that wants to take a grip here, push or pull when they are turning independently, or helping when you're helping them. If you're raising the head of the bed, there's always a risk of sliding down, but if you want to prevent that, we can take away the sliding here just by taking a grip in the draw sheet just by the hip, and then take the lower end and slide it up underneath like this. When you do this on one side, you can later go to the other side and do the same thing. And when you've done that, it's a high friction material underneath, and then it's not sliding. When you're done and start sliding again, when you are lowered the head of the bed, you just pull it out and you're ready to go again. When you're using a product for turning in bed, you need to look into friction, shear and pressure. It's important that you find a good combination between the product for safe patient handling and the mattress. When you have a product in the bed here, it can help you to reduce friction and shear. And if you have a group that is not so experienced about pressure and shear, I have a small exercise that you can go through with them. You start here with the finger like this, and now visualize that this is a bad mattress giving you hard pressure, and then you buy a new mattress and that gives you low pressure. But even a good mattress with low pressure will give you friction and shearing if you start moving the patient without looking after friction and shear. Friction is what we say is between the sheet and the patient. If you have high friction, it will be heavy to move a person. It can also create heat on the outside of the skin that is bad. If they have a pressure wound, you can tear up the pressure wound again. And instead, the word shearing means the inside the skin, all the layers that is moving against each other. And if the person is sensitive, that can create a pressure wound. With the WendyLett, we'll take away both friction and shearing. Since the body is on top of the draw sheet, and when you move, all friction and shearing is underneath. Now to the best part. Even a very expensive mattress that gives you really low pressure is not enough. The body needs no pressure sometimes. So by turning, you will move the body so that the part that just had pressure will be up here with only the pressure from the air, and that is what we really like. After you have turned the patient, you need to help them to adjust their position. If you move the hips, you need to think about a pivot point by the shoulder and move it in a circle. If you pull and pull, you will move the hips. If you pull and push, you will rotate the hips. It's exactly the same for the shoulders. Now the pivot point is here by the hip, and the shoulder will move in a circle. If I pull and pull, I will move. If I pull and push, I will rotate. Now I'm going to show you from the other side. Same again here, the pivot point is here, so I need to move in a circle. I pull and pull if I want to move. I pull and push if I want to rotate. If I want to rotate the hips, pull and push. If I want to move, I need to bend the knees first and pull by the knees and then hip. Pull and pull means moving. Now we're going to show you turning on the spot. The normal, most common version of turning is that you move a patient out to the side, then you bend their legs, you move their arms a bit, move a pillow, and then turn. But when you're doing that, you need to move all the way out to the side. Some patients will be afraid because they feel that, oh, I can fall down here. Other patients might be, they are filling up the bed. So it's impossible to move them to the side because they are already at the side. And then turning on the spot is perfect. You can do it with 1 or 2 nurses and in combination with other products, but like using the lift connected to the WendyLett 4-way. But now I'll do it manually by my own, and the patient will be a little bit active. Okay, so you can bend your leg, please, and you can move your hand up and put this hand over on that side. Now, rotating was push and pull. So I push and pull and just move an inch. And after that I go up here, push and pull. And then I repeat this, push and pull, 10-15 times. Don't try to do all at once, because then it's heavy. If possible, try to reach over with your hand. Oh, not yet. Soon. That's good. Push and pull. When you do it like this, you will reduce the load on your back. You will reduce the fear that the patient might feel, and it's just happening.